Hi, I'm Dr. Kate Kresge, a naturopathic doctor and a huge fan of the Redefining Medicine podcast. Like you, I tune in to get inspired by the visionaries who are moving whole person care forward. Whole person care takes a whole lot of work, and staying inspired is half the battle. The other half? Finding the right partners to support your practice. That's where FullScript comes in. FullScript helps you capture patient data, dispense supplements, order lab testing, and keep your patients on track, all in a single platform that's completely free. FullScript helps you streamline your workflow, grow your practice, and deliver whole person care at scale. And with FullScript's acquisition of Rupa Health, you'll have access to even more lab tests on top of the 1,000 already on the platform. I can think of 100 reasons to join FullScript, and you can read more about them at fullscript.com/A4M. Now, back to the podcast.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, we're back in Las Vegas with Longevity Fest 2024, the most unbelievable event. 7,500 people registered. We're here. The main room gets 35 to 4,000 people watching, standing room only. It's amazing. The speakers, one more impressive than the other, from Harvard, from Stanford, from Yale, from Columbia, from Cornell. Everybody is coming together to focus not just on longevity, but on prevention, on how we can start changing healthcare for the better. And I have the honor and the privilege of having an amazing speaker with me, Dr. Mimi Guarneri, who's a cardiologist with an amazing pedigree that fits everything I just talked about before. Thank you so much, and let's talk about women and cardiovascular disease, because we didn't know about this for the past 20 years.
Exactly. And what's hard for me to believe, it's 2024, and we're still talking about cardiovascular disease being the leading cause of death, morbidity and mortality for women. We're still talking about how women are being undertreated, underdiagnosed, not as aggressively diagnosed as men or treated as men. So we have a long way to go.
No kidding. You know, I had this woman recently, my practice is in New York City, right? And I had this woman in her 50s who went to the emergency room with, what kind of pain, and they sent her home.
This is not unusual.
Oh, no, 2024.
2024, and we're still judging the book by the cover. Oh, she looks good, can't have heart disease. It's look, the bottom line is we need to do more on the prevention side. We need to recognize it's the number one killer for women. We need to be aggressive with our diagnostics. Particularly CT angiograms, which we talked about today for women. We need to not treat women like little men,
We're not little men.
It's
We're a lot more complicated.
Yeah, much more complicated. Exactly.
We're a lot more complex. We have a lot more going on.
Exactly. Mm-hmm. So some of the take-homes for today is, the things for people to remember is we're starting to see in the cardiology literature for the first time this whole discussion about non-obstructive cardiovascular disease and ischemia in women. So we know that if you send a woman for a routine angiogram and they say, you don't have a 50% blockage, you don't need a stent, don't worry about it. Well, what the data is showing us is that these women have significant problems. Yeah, worry about it.
Yes.
And our job, and I think why we're all here at Longevity Fest, is because we want to get to these things before they occur. Right? We want to deal with all of the underlying factors, whether it's lipids or hypertension, diabetes, insulin resistance, sleep apnea. I mean, the list goes on and on.
Stress, cortisol on top of everything. Because we take care of everything.
Well, that's exactly right. But we also handle it better. We handle stress better.
Yeah, we do, but you know what? Look,
Sorry, guys.
cardiovascular disease is killing us, so
It is. No,
we
it
got to
is.
protect us.
And also we have to remember that there are things that nobody is talking about. I mean, I'm seeing women in my practice now with infections that are affecting the heart, like Bartonella.
Right.
I'm seeing women with high lead, women with high mercury, all of these things that conventional cardiology is really not even putting into the algorithm yet.
Right. Well, you were saying about that finally they're starting to talk about how heavy metals are actually causes of heart disease, which is
Yeah.
unbelievable because everybody comes in, we do heavy metal testing.
Right, we've been doing this for years.
For how many years? Right,
And-
exactly.
And even in cardiology, it was the old tax study. I was a principal investigator in the day. And even when they wrote the paper, they said, unexpected benefit of chelation therapy.
Could you imagine?
They even the title made it,
Unexpected.
Unexpected.
Because they're women, so you don't expect.
Yeah, well, look, the bottom line is we need to be paying attention and we need to be aggressive.
And you know what? The beauty of it is things are changing. And they are changing, and we lived long enough to see it change.
Yeah.
And it's going to change.
Absolutely.
And I don't think we're going to have so many women dying of heart disease because they got ignored, because nobody listened to them anymore.
Well,
because they have
we're
people
ringing
like
the
you out
bell,
there.
Right? We're making the noise.
The more noise, the better. And you know what's so beautiful is that it's not like we're screaming in the dark anymore, because the 7,500 people here and the people watching and the people who are listening, they're more and more. And then the other thing is, I think, and I'm sure you see it in your practice, that women are starting to own their health, that they're not afraid or intimidated anymore to the same extent, because there's a lot of room for improvement, but to the same extent that they were before.
And not only are they taking control of their health, they take over the family's health.
Always.
Which is fundamental.
Right.
Like, look, I'm a cardiologist. How many women bring their husband in
Of
to see
course.
me? Oh, take care of his heart. I
Sure.
say, who's taking care of your heart?
Yeah, right, exactly.
Right? What do your lipids look like? Well, do you have coronary calcium? What's happening with you? Women keep thinking, oh, I have a normal mammogram, normal pap smear, I'm done.
As if
Right.
that's really what defines women's health.
Exactly.
How offensive is that one?
Big one. You and I feel the same.
We know. I think we all do. I think, tell me about your practice.
So my
It's in
prac-
California.
yeah, I'm in La Jolla. I'm in a beautiful place.
Oh my God, I love it there.
Like you, I have a concierge practice.
Yeah, but
And-
it's not in La Jolla.
Yeah, well, New York's okay.
Yeah, you were there, you know.
And even though I'm a cardiologist and I have another cardiologist colleague with me, everybody's trained in functional medicine, integrative medicine. We have naturopathic doctor, traditional Chinese medicine doctor. So we see the full gamut, right? People may come in for the heart, but you know this. It ends up being about hormones. It ends up being about the gut. It ends up being about heavy metals. You have to take care of the whole person. And one of the things we talked about this morning that I think is important for everyone to think about is this whole concept of sleep disordered breathing and sleep apnea. I showed a bunch of cases today of women, one of whom was told she had to be on multiple medications for cognitive decline, severe sleep apnea, completely missed. Another woman with heart failure, preserved EF, severe sleep apnea, completely missed. So, we have to dig a little deeper. We have to broaden our lens and not be afraid to do that. Check these things.
I interviewed somebody yesterday, I think, who was a pulmonologist who became integrative person and realized how the CPAP is not the answer, and that sleep apnea was really a big problem. And it was so happy, it made me so happy that they're starting to hear. But then I was like, so what's the answer? What's the solution? Well, they still haven't gotten to the fact that we need to find out what the core issue is.
Yeah.
So what do you do in your practice?
Well, it depends. Like you can screen right out of your office today. We have
Right.
excellent screening tests.
What do you use? Tell
I
us.
use the WatchPat, which
Yeah.
is from Itamar, same company that makes the EndoPat. Great product. And I also use something called a Vivos ring. It's a little ring that you can put on, talks to the cell phone, and I can do multiple night sleep studies on people.
Beautiful, so they don't have to go anywhere.
We don't send people anywhere anymore.
We don't
I mean,
either.
unless it's extremely complicated, central and obstructive, and it's a big deal. We don't need to do that anymore. And then you have to look for what's the underlying cause, right? Like everything else, our whole philosophy is what's the underlying cause.
Exactly.
And let's unplug that. For some people, it's as simple as weight loss.
Right. Amazing.
Yeah.
Amazing. Nobody's talking about the fact that obesity is at the number one, the baseline.
Right. I mean, we don't have, from a cardiac standpoint, it's everything, right? And what was interesting is the American Heart Association just about 2 years ago finally again said, hey, guess what? People that are on 3 blood pressure meds, people that go to the emergency room with heart failure, people that are having AFib ablations and need another ablation, think about sleep apnea. Okay, here we
Beautiful.
go. So it's happening. It's happening.
Mimi, it's a pleasure. It's a pleasure. Keep on doing the great work because you know what? We are changing healthcare.
We are. We are the change.
We are.
Thank you.
Thank you.